This video will cover the various components of the dental chair. Areas that we will look at will include the dental chair, the continental over-the-patient delivery system, the intraoral light, the assistance arm, and the Cavitron tray. We'll now move to the right side of the dental unit. The dental chair is composed of a back, a base, and a headrest. The back of the chair and the base of the chair can be moved into different positions. Controlling the position of the back of the chair and the base of the chair is done by the keypad. We'll show you the keypad later in this video. The headrest can be repositioned to accommodate any patient that is sitting in the dental chair. The headrest can be kept in a down position. It can also be moved to a fully extended position, and it can be moved to an extended forward position. Looking at the back of the headrest, you will see a lever. If you push the lever in and hold it, it will allow the headrest to move into a forward position. On the back of the chair, well below the headrest, where the base and the back meet, you'll see a lever. This lever controls whether the chair swivels to the right or to the left. It's known as a brake. The lever here, or brake, is shown in a tightened position. To loosen the chair so it can swivel, you move the lever to the right. Once the chair has been moved into the desired position, you move the lever back to the left to lock the chair in place. Let's now move to the left side of the dental chair. The dental chair will have an arm on both the right and left sides. This arm is being shown in a down position. The arm can also be moved to an upward position as you see here. Just below the left arm and at the base of the chair, you'll see an electrical outlet with two plugs. These plugs represent air-water connections, and you'll learn about these later on in your program. The next area we want to take a look at is the over-the-patient delivery system. On this delivery system, you'll find an instrument tray. This is showing you the actual delivery system, and we'll talk about this shortly. This is a keypad. This is an air brake handle, and in the background you see the self-contained water system. Let's now take a closer look at the delivery system. Starting on the left, you have an air-water syringe. Next, you have a curing light. This is the connection for a piezo scaler, and these are connections for dental handpieces. On the far right, there's a keypad. Below the keypad is an air brake. Let's first take a look at the air brake. The air brake will function as a handle and will allow you to move the delivery system into different positions. The air brake handle has a button that will allow the positioning of the delivery system vertically. When you push the button in and hold it, you can move the delivery system up and down freely. Once the delivery system has been moved to the desired position, you release the button and the delivery system stays in that position vertically. The keypad will control the chair's position. The keypad will allow you to move the chair up and down, as well as moving the back of the chair into a reclined position or an upright position. This control on the keypad will turn the dental light off and on. It'll also dim it. These arrows control whether the back of the chair is either upright or reclined, while these arrows control the base of the chair to move up or down. The bottom 3 buttons are used for automatic programming. The lower left control will lower the chair and raise the back of the chair. This button is used when you want to allow the patient to exit or leave at the end of an appointment. This control will lay the patient in a supine or reclined position. This button will set the patient in an upright position, with the base of the chair taller than an exit position. This button with the letter P will allow you to reprogram any of the settings on the programmable control buttons. If you look at the side where the keypad is located, you're going to see a single lever and several knobs. The knobs are used to increase the air and water that flows to the handpieces. The lever is what we call the master switch. The master switch actually turns the entire dental unit off and on. The master switch is being shown in the off position. To turn the unit on, you flip the switch upward. The last thing that we want to cover with regards to the delivery system is something called the rheostat. The rheostat will actually control the speed of the dental handpiece. There's a toggle switch on the top of the rheostat that will control whether water comes out of the handpiece or not. If the toggle is turned away from the blue dot, no water comes out the handpiece. This is the position where the toggle is placed when you're using a slow speed handpiece. If the toggle is turned towards the blue dot, it means that water will come out of the dental handpiece. You put the toggle towards the blue dot anytime you use a high-speed handpiece. Let's now take a look at a dental light. From a side view of the light, 2 switches are seen. The larger switch will turn the dental light off or on. Turning the dental light off and on can also be controlled by the keypad. The smaller switch is an intensity switch and will dim or brighten the light depending on the setting. We'll now move to the left side of the dental chair and take a look at something called the assistance arm. The assistance arm has several joints that will allow it to be placed into different positions. A closer look at the assistance arm shows that it also has a keypad. The keypad will function in the same manner as it does on the delivery system. In this picture, to the left of the keypad, you can see an air-water syringe and a saliva ejector. To the right of the keypad, there is a high evacuation suction and a saliva ejector. If you follow the tubes from the assistance arm, you'll see that they connect to the side of the dental chair. This is where the suction trap is located. The suction trap has a removable top. Once the top is removed, the suction trap can be seen. You're also going to learn that this can be broken down further, so you can either clean the trap or replace it. The last area that will be covered on this video will be the operator and assistant stool. This is an operator stool. The stool can be adjusted to allow for proper operator positioning. This lever will raise or lower the stool. This lever will adjust the tilt of the stool. And this knob will allow for the backrest of the stool to be raised or lowered. This is an assistant stool. The assistant stool has an arm that goes across the lap and will help keep the assistant in an upright position. The lever underneath the stool will allow the height of the stool to be adjusted.